There is no informed consent without body literacy. If you don't know how your body works in a state of health, you can't wrap your mind around what's at stake with any given healthcare decision.
Hello and welcome to the Natural Womanhood Podcast. I'm your host, Grace Emily Stark, and I'm so excited to be here today with a really special guest. Her name is Katie Vidmar. She is our new Director of Programs here at Natural Womanhood. Our team is growing all the time. It's so exciting. And we recently brought Katie on to help us grow some of the great programming that we've talked about on the podcast in the past season, our cycle mindfulness clubs, our natural marriage groups, Period Genius, all those great things that you're coming to know and love us for. And so Katie, this upcoming weekend, is actually going to be helping with our Cycle Mindfulness Club leader training. And she has really helped revamp some of the topics that the girls are going to be talking about and learning about. And one big one is the concept of body literacy. So for those of you who don't know Katie Vidmar, she's is it fair to say you wrote the book on body literacy? I mean, you wrote the flip chart.
Right.
And we'll get into what I mean about that. But Katie's kind of known as the body literacy queen, y'all. And so we're so excited to have her on our team, because that is really at the core of everything that we do at Natural Womanhood, is empowering women to know, love, and understand their bodies and their fertility. And so Katie is really helping us grow out that mission here at Natural Womanhood. So without further ado, Katie, please introduce yourself to our listeners.
Thank you so much for having me, Grace. It's really an honor to be here, and it's an honor to be on the Natural Womanhood team. I've admired your work from afar for a very long time, so it's exciting to get to be part of the cause more on the inside. I live in North Dakota with my family and my kiddos. I am a Billings Method fertility awareness instructor. I'm a former executive director of a nonprofit women's health clinic, and have just a passion for bringing the knowledge that is our birthright to every woman, regardless of her socioeconomic status, regardless of her age, regardless of her intellectual abilities, right? Mm-hmm. I think that every woman deserves to know some basic truths about our design and about how we optimize our health as women. Yep. And I think it's fair to say that most women are in the dark about these things.
Yep. Through no fault of their own, right?
Correct.
Yep.
Absolutely.
Yeah. And so, Katie, you wrote, let's get into what I was talking about with the body literacy flip chart.
Yeah.
You developed this program called Elevate. And let's hear a little bit more about that, because it's a great explainer for the direction that we're going now at Natural Womanhood, and why we brought you on to kind of grow out this part of our mission.
Absolutely. So I just saw that there was really a gap. There are so many amazing, comprehensive fertility awareness methods out there. But when it comes to boots on the ground, clinical tools to be able to deliver bite-sized chunks of knowledge in these areas, there really was just a gap that I was experiencing as I was leading this clinic. So I set about 4 years ago, I set back from leading a specific center and started doing some private consulting. And just was able to make that my main focus. How do we crack this code? With all of my knowledge as a fertility awareness instructor in the background, what does it look like to distill this vast body of evidence that we have for holistic women's health, but to distill things down to what's simple and essential and easily communicated, both for the healthcare professionals who are doing the teaching, but also for those receiving this knowledge, maybe for the first time. Yeah. And I emphasize distill, right? We're not watering anything down. We're just getting really clear about what matters most, because our time is limited the attention of our patients is often limited, and we need it to be easy. It's allowed to be easy. And so I think what you're referring to is I took, the Billings method intro session runs about an hour and a half. And that is way too long for a clinical visit, for sure. And even to try to invite someone to a workshop off the bat with no context, that's a big ask. And so I thought, wow, what would it be like to take the basics and put it in a scripted format? So we've really carefully chosen that language ahead of time. And I made a flip chart that goes through the basic external and internal anatomy, the 4 phases of the cycle. Our hormonal health affects our overall health. Ovulation is a sign of health. It's a 5th vital sign. And then you can learn to read your body and track your cycle so that you know where your unique physiology is at any given time. And then just really high level, you track your cycle for health. You can track it to avoid pregnancy or achieve pregnancy. And that's it. And when I go through, it takes me 6 minutes and 27 seconds, which is far cry shorter than an hour and a half.
Yeah, well, so I've volunteered, I think, with the Couple to Couple League over the years, with my husband teaching their full natural family planning fertility awareness course to other couples. And it's 3 sessions, and they each run about 2 to 3 hours long, depending on how much, just kind of like chatting we do with the couples. And yeah, that's a steep barrier to entry for a lot of people who don't have the time or don't already have the buy-in that like this is something that you can do or should do or that is good for you to dedicate the time to do. And so, the shallow entry that your program provides for busy healthcare professionals to be able to kind of just get their patients' toes wet into this space and just to get them kind of thinking, reorienting the way that they think about their bodies and their cycles is so critical, and it was so needed. And so it was so awesome to watch what you did with this program and the way that it has expanded all over the country. And so that was a big reason that Gerard, our CEO at Natural Womanhood, he saw what you were doing. He saw that you had grown this kind of you'd created and grown this program. And with our cycle mindfulness clubs, our period genius, our natural marriage groups, and some different ideas for programming that we have, Gerard took a look at Katie and said, we need her to help us grow what we're doing, because it's very, very much aligned and very similar in the way that we've kind of grown up these programs. And so that's been really, really awesome to have Katie on board, to have you come on board to help us with these things. And so I know kind of your first big project for us has been revamping some of our cycle mindfulness club training. And so just to remind our listeners, we have this series of clubs on college campuses across the United States. And actually, we had one in, where was it? In Africa, Uganda?
That's right.
Yes. And are we still going to have one?
We will be back in Africa this year, yes.
Awesome. Okay, so we have these clubs, mostly across the United States, with one in Uganda, of young women who gather together and kind of a la what Katie has done with Elevate, have a very kind of shallow entry into what it is to learn about your body, to know about your cycle, to kind of become literate in your fertility and what that means for you as a woman, and then to also kind of contextualize like what the lived experience of a woman who cycles naturally is like, and how it can change the way you think about your relationships and what you're going to pursue as a career, and just kind of all of the things that help us flourish and be whole persons. And so Katie has helped with revamping, like I said, the training, which this episode will publish in a couple of months. But right now, in the here and now, on June 2nd, in the year 2025, this upcoming weekend is our Cycle Mindfulness Club training. And so I know, Katie, one of the big things that you have done is really emphasize consent, that we can't consent to a lot of what passes for healthcare in women's health when we don't actually really know about our bodies and the way our bodies work. And so can you talk to me about what the girls are going to be learning on that front, and how it plays into this idea of body literacy? Because I feel like that can be kind of a nebulous concept for a lot of people.
Absolutely. I think the heart of it, Grace, is that we cannot protect what we do not know. And so when a woman understands her body, and like you said, can read her body, that becomes like the horizon towards which she orients all her decisions.
Yep.
That she understands that she optimizes her health, not just her physical health, but her emotional health and well-being as well, and arguably her social health and well-being when she prioritizes protecting her natural design. There is no informed consent without body literacy. If you don't know how your body works in a state of health, you can't wrap your mind around what's at stake with any given healthcare decision. Yeah. And I think this is like the bedrock focus of at least one of our topics that we move through with the Cycle Mindfulness Club leaders. And it's specifically about medical treatments. And how do we discern what medical treatments are right for us? And, you know, we are not here to judge, but we are here to make sure that every woman has a truly informed consent and that she understands the full range in front of her and the potential future impacts of her decisions now, that often women are kept in the dark about. And then when they find out 10, 15 years later, they are not happy. And I think what we want to do is empower women ahead of time so that they never end up in that experience of disillusionment.
Yeah. Yeah, and that is something that, you know, I have a lot of experience with, just having taught couples over the years fertility awareness, that, you know, we're seeing young women come in their 20s, sometimes even their early 30s, just getting ready to get married. And yeah, they do have that disillusionment. They're so happy to finally learn about their bodies, but they're also angry and they feel disillusioned that they're just now learning about this right before they're about to get married, and that they could have made different decisions much earlier on in their lives had they had the body literacy that they're given in a fertility awareness course. And so, but we don't have to wait that long, and we don't have to you don't have to sit through three-hour classes or however many, however long your chosen methods course is. You can get all of this much earlier on. And that's something that we have really just internally as everybody who works at Natural Womanhood for years, we've talked about how do we get this information to women earlier. And so one of those ways is with the cycle mindfulness clubs. And we hope that the women in those clubs learn about it and become empowered with this information, and that they kind of spread that in their campus communities. And so it's been so exciting to see it grow from just a couple of clubs 2 or 3 years ago when we first started to now. How many are going to be at the training this coming weekend?
25 campuses next year.
Amazing. And so what are you hoping the young women come away with after this weekend, and especially with some of the different changes you have made to the training?
Yeah, I love that question. I mean, our direct aim, again, is to give women the knowledge of their bodies that every woman deserves to have. You know, that's what I can control as the director of programs, to make sure they have really robust, medically accurate information. Mm-hmm. The fruit that I hope comes of that for the women is that they have an interior transformation in their identity as young women, that they feel so confident in their design, in their bodies, in their ability to navigate their life decisions, especially their healthcare decisions.
Yeah.
And I think that's the thing about body literacy that has everyone scratching their heads a little bit is that, yes, it's true that we're trying to pass on knowledge, but the effect is more than that. The effect is transformational for young women when they truly become grounded in a natural level in their femininity. It changes everything for them. It changes their whole outlook in a good way. They understand that they find their freedom as women by working with their body's natural design and embracing that. And this is precisely what women's liberation is all about.
So, and that's so counter, right, to everything that we are steeped in, because as, a teenager in the early 2000s, mid 2000, when was I a teenager? Yeah, I guess I would have turned 13 in like 2006 or something like that. You already kind of have this idea that like getting on the pill is kind of how you become a woman, like that's actually your rite of passage, right?
Right.
So many of these girls in the clubs, have also been steeped in that. And so what do you think? Do you think it's a little bit jarring for them? Will it be jarring for them to come and hear something that's so radically different to what they've been steeped in? And how do we navigate that? How do we help them kind of have this?
That's a great question. I mean, we have vetted them rigorously, right? And so the fact that they desire to lead a club like this in the first place means all of these women have already, to whatever degree their knowledge base is, already embraced this vision of themselves and health and that kind of thing. And I think that the work for us is really coaching them about how to accompany women that don't have that grounding.
Yeah.
And that's, I think, the most important part of what we pass on to them is how to listen well, how to affirm common values that we have with women who maybe haven't been brought into this understanding of their bodies and health. And then how to propose gentle questions that help others identify what are my assumptions about my body, and is that really true to my experience? Do I really hold this? And again, like not in a adversarial conflict kind of mode,
but in a gotcha
real,
kind of way, right?
Yes, like out of friendship and accompaniment, right? Like if this is really true, and if the truth sets us free, then this is something that we want to share with others out of friendship, compassion, and love, right? And so for me, teaching them how to create that atmosphere within their gatherings that fosters that kind of radical trust and openness. Because I think it's true, right? Like I go to the doctor and they say, "Are you on any medications?" And I say, "No." And they say, "Not even hormonal contraception?" Every single time, Grace. And I really think it's because the cultural mindset is it's so normalized to adopt what is, it's medically accurate to say, an artificial physiology. And that this becomes the norm for people, and they don't even understand the jump that is, because they've never been taught how their body works in a state of health in the first place. So again, we're not here to judge that decision, right? That is no one's fault, and yet it happens. And so with like gentleness and compassion, we want to be able to share the truth of women's design for the sake of empowering these other women's informed consent.
Yeah, I know, because to your point, the normalization and just how women will be on birth control and not even answer like, yes, I'm on medication when they're asked that. Like I've heard of that happening in emergency rooms where young women, I know of someone who, I think she was in her 30s, was having symptoms of a stroke and went into the ER, and the first thing they asked her, was, "Are you on birth control?" They didn't even ask, "What kinds of medications are you on?" They asked, "Are you on birth control?" And it just, gosh, it really speaks to the fact that the medical community knows that birth control does this stuff to women's bodies, and yet it's only when we're at this like critical juncture where we could be irrevocably harmed, where there's that admission, that immediate like, oh, are you on it? And for a lot of women, yeah, they would go into the ER with different symptoms of things and answer on the form, you know, are you on any kind of medication, and just completely leave off their birth control because they've been taking it like it was a vitamin since they were 12 or 13 years old. And so, yeah, I think it's really important when you're talking about how we accompany women for whom this has been their reality, their entire, you know, from their adolescence on to wherever they are, however old they are now.
Right.
How we kind of ask the right kind of questions to get them to see that this is the reality for them, that they're living in a way that is what's the phrase that you use, the being used to the synthetic, what was it, how did you phrase
Like
that?
an artificial physiology
Artificial
has become the norm.
Yeah.
Yes. Yeah, I think that there can be so much shame tied up in it, because the implicit message, especially for women who were first prescribed because of acne or irregular or painful cycles, like the implicit message is you're broken. And you're broken so much that we can't even begin to identify the root cause of this. The best we can do for you is suppress your symptoms.
Yeah.
And so I think that becomes internalized for a lot of women, that attitude. And then I think we need to acknowledge too that birth control use for many women is directly tied to their sexual experiences as well. And that can be a whole other layer of emotional everything to unpack. And sometimes shame, sometimes regret. And so, you know, to go after birth control directly is this holy grail, right? Like the third rail, like you don't touch it, right?
Yeah, right.
And again, like I wouldn't say my understanding of how we view things at Natural Womanhood is that we're anti-birth control. I would say that we're pro-informed consent.
Yeah.
And that we're not here to try to take away access or tell women not to use it, right? But like have your eyes open and know what's at stake. And that's really the tone that we've tried to adopt in forming our leaders at the training coming up this weekend.
Yeah, that's so important. And I've really just been struck even more so in the last several months with all of the conversation around infertility in our country and what the best approach is as a society towards treating infertility, and where we're going to throw funding and all sorts of things around that central question of like, our birth rate is falling, people are struggling to get pregnant, what are we going to do about it? And there's been so much pushback about cycle education when it came out a few months ago that there were organizations that were encouraging the Trump administration to look at funding cycle education for women. There was so much pushback from women in different corners of the internet that, oh, I know my cycle. I've been living it since I was 12. I don't need anybody to educate me about it and that sort of thing. And I just know that women writing things like that are thinking about their periods. They're not thinking really about anything else. It's just kind of evident in the way they talk about the rest of the infertility issue, is that they view their cycle just primarily as when they bleed every month.
Right.
And, sure, if that's what we meant by body literacy and cycle education, you'd have a right to be really annoyed that there's a male-led administration considering teaching you about your quote-unquote cycle, right? When you've been living the reality of having a period since you were 11 or 12 years old, that would rightly rankle you. But we're talking about so much more than that, and it's so hard to communicate that to women who just hear cycle or menstrual cycles and think periods.
Right.
And so how do we come alongside our sisters for whom they hear that and all they think is periods, and their association with their periods is largely negative. How does body literacy stand all that on its head, and open their eyes to the reality of it being so much more?
Right. I think especially for women who struggle with period pain or any kind of cycle irregularity, I think helping them see that your body is trying to give you a message, right? And even when it's causing you pain, it's in that moment doing something intelligent and giving you a signal that it needs more support.
Yeah.
And so even just kind of reframing that, right? Like, even when this happens, my intelligent, brilliant body is trying to tell me something. I think that can be a great place to start. And again, I think informed consent is a great common ground. What woman doesn't want to have informed consent? Like, we all want to know that we have transparency with our healthcare professionals. We've talked a little bit off camera, Grace, about this power differential that exists in medicine.
Yeah.
And that body literacy really seeks to flatten that power differential. So it isn't just the physician who knows things and we who blindly follow, but that there's a shared decision-making process that takes place that takes my values into account. And that someone has taken effort to make sure I have full knowledge. And what woman doesn't want that? Right? The United Nations talks about informed consent as a basic human right. It's in their declaration on the rights of indigenous peoples. And they talk about it in terms of a free, prior, and informed consent. So FPIC is their acronym. So there's no coercion happening. No one's being forced. That there's prior consent, that you're given adequate time to absorb the information and to weigh the advantages and disadvantages of your options, and that you have information about the full range of issues, both present and future, that could play out should you make one decision over another. And when I really unpack that for women and they look back at especially specific difficult encounters with medicine, they say, well, my rights were violated. I didn't have that. I think during the conversation there can be a great place to unearth some common ground and start to build some bridges.
Would you say, I already know the answer, but would you say that any woman who started birth control under the pretense that it would regulate her cycle has assented to it with informed consent?
She absolutely does not have informed consent because it is not medically accurate. We're not treating anything. We're not regulating anything. What's most medically precise, I think, is to say that we're suppressing a symptom. And suppressing it, suppressing our whole hypothalamic pituitary ovarian axis, right? We're interrupting that complex communication between our brain and our ovaries with intention. And that because we have hormone receptors all over our body, that this isn't just helping us alleviate our period pain in the short run. This is having secondary effects everywhere that we're often not aware of.
I almost I've started to think about it in the analogy of, like, if I went to a cardiologist with an irregular heartbeat and they said, oh, I can regulate your heartbeat, and then they just shot me and I died and my heart stopped beating.
Right?
Or they injected something into my heart to stop it from beating. Like, that's kind of akin to what birth control does to the reproductive system. You can say, oh, yep, it's it's regulated. It's not irregular, right? When it's not
Right.
functioning at all, like
It's
I would have not have an irregular heartbeat anymore if somebody stopped my heart from beating.
right.
And we obviously, like, we're laughing because that is so insanely ridiculous. There's no way we would ever imagine that that's how medicine would function for any other system of the body.
Right.
It just isn't. I can't, it
Right.
didn't come to mind because that's not how medicine works.
No. And in fact, in cardiac care, now we go to great pains to treat root causes, right? Like in the 1960s, cardiac care was a lot of morphine and hand holding. We just managed symptoms because that's all we knew how to do. And now look at what this whole world is open to us.
Yep.
But we don't say restorative cardiac care. It's just assumed that the whole point is to restore healthy anatomical and physiological function. And yet the logic is different in women's health.
Yeah.
And I think part of it, right, is that you can't live without your heart,
Yeah.
but you can keep living without your uterus.
Yeah.
And right, like every system in our body is ordered toward our reproductive system. And it is the foundation. It exists, my digestive system, my skeletal, my bones, like they exist so that I have the potential to carry on to the next generation.
Yeah.
But because our body is ordered in this way, yes, we can survive with our reproductive system suppressed or anatomically, without bodily integrity for our reproductive organs.
Yeah.
We can survive, but at what cost to our health span and our lifespan? I have a friend who points out that we have a 40% hysterectomy rate in our culture. So 40% of women die without their wombs. And she says, if 40% of men died without their testicles, I think someone would do something about it. Right?
Wow. I did not know it was that high. Wow.
Right. And again, like you can live without your uterus. And because of the glaring lack of research, we don't know what we don't know about how that affects a woman's health span and lifespan. Because in science, we only get answers to the questions we ask.
Yep.
And no one's asking.
Yeah.
And there's no money in asking. And there's all these perverse incentives built into our system of peer review, which makes it really tricky to have informed consent.
Yeah.
And
I
women
think-
are often facing really hard decisions, right? Like maybe they have terrible uterine fibroids and they have chronic anemia because they lose so much blood.
Yep.
I would seriously consider a hysterectomy if that were me, right? Again, like we're not here to judge, but did my friend who made that hard choice have informed consent about how that was going to affect all the things? Her intimacy with her husband, her risk exposure to heart health problems, the list goes on. And she didn't know.
Yeah.
And now she's reading Natural Womanhood articles and finding it out after her womb is gone.
Yeah. And then the other thing too is I've had a few friends lately who have had hysterectomies for various reasons. And I have been absolutely floored that I'm the first one to bring up pelvic floor therapy with them. That it's not something they have heard of. It's not something they've thought of. I cannot believe that a doctor would go in and take out an organ and leave a empty space in your pelvis and then not communicate to you how important it is to keep your pelvic floor very strong so that things are not falling out in 5 or 10 years because of this empty space now that's not holding everything else in place. It's not occurred to them, and their doctors have not mentioned anything to them about it. And it's just absolutely incredible to me how deep this goes. And it's a good reminder too, because I have, I'm in my 30s, but I have friends in their 40s who are in menopause or close to it. And so that's why I'm starting to see friends on the other side of things, and now talking about hysterectomies and that sort of thing, it's a good reminder that body literacy informs a woman for the entire health lifespan of her fertility, and that, yeah, it's so important that we talk about the different issues with birth control and consent to birth control on the earlier end of things, but then also realize that this need to know our bodies and understand our bodies doesn't just end there when we're talking about the fertile baby making and baby having years, but that we understand that we still need to know about our bodies and care for our bodies properly, and still navigate the healthcare system with all of that in mind. And then again, that just, gosh, it seems so intractable, right? Because and it does come down to that power differential with just going to your doctor and just trusting that they're going to give you everything you need to make an informed decision about your health. I just don't know where we start with fixing this. So fix it, Katie. Tell us how we fix it.
I mean, there's no easy solution, right?
I know.
But I do think, right, that it starts with educating anyone that will listen to us about how the woman's body works in a state of health. Yeah. And then just trusting, right? Like you mentioned earlier about how there was mention of possibly some government funding where the man was going to start to teach women about their cycles, and how that was not received very well.
No.
So this is, I think, the power of cycle mindfulness clubs and really any kind of women's circle, because women trust women.
Yeah.
And the more that we can play this role of accompanying those around us, the better. In my work with healthcare professionals, I serve a lot of nurses who are in their 40s and 50s, and they're learning this for the first time. And they have daughters that now they're going back to and introducing. I have one center that she bought Lisa Hendrickson Jack's book, The Fifth Vital Sign, for all of her daughters. And one of them, a year after I started working with this particular nurse, her daughter's going in for endometrial surgery, and wouldn't have even known to pursue that, like one and done endometrial surgery for endometriosis, if she hadn't been brought into this whole world through relationships with other women. Yeah. And so I think that's where our hope lies. And I think there are so many well-intentioned, open-minded, excellent healthcare professionals out there who just don't know what they don't know. And I think it's so powerful as a patient to come forward and say, I found this evidence. Would you be willing to look at this with me? Because this treatment plan that's described here aligns with my values. Yeah. And if you're willing to look into it, I'd be really grateful. Yeah. And I've seen beautiful fruit coming from those kinds of conversations.
Yeah. And I think too, a willingness to, and I know it's hard because you can suffer for so long. And especially if you're a busy mom, and it might take you several months to get to your doctor when you're having issues. Say, a lot of women end up with fibroids. We were talking about that in their 40s, and that's a big reason for a lot of hysterectomies during that time frame. And you maybe have been having horrifying periods, horrific periods for several months where you are just bleeding and bleeding and bleeding, and you're exhausted. And by the time you finally work it into your schedule and into your doctor's schedule that you get to see them after dealing with this for 6 months, you can just kind of want to jump to whatever they're offering you. And I think the appeal on that side of things too is like, well, if I get a hysterectomy, I don't have to worry about this NFP thing anymore, and it's kind of a hassle when you're in perimenopause and things are up in the air. And so you can, kind of jump at different options that are offered to you that are seemingly going to provide you relief. And on the younger side of things, that's certainly what we see with birth control, women suffering since they were teenagers with painful periods, heavy bleeding, what have you. And then you're offered what seems like an out. And again, on the birth control side of things, it's also, and I don't have to worry about getting pregnant. So you can see why it's so appealing when you're offered, here, this will solve your problem, and you won't have to worry about getting pregnant, why women jump at it. And so I think it's hard to give this advice, and I don't even know if I would take this advice if I was in that situation, but just knowing you don't have to make a decision right away. And that comes back to the informed consent declaration that you were just talking about with the WHO, is women need more time. You need to take that time to think about and understand what it is you're getting yourself into, what it is you are agreeing to. And yeah, that's hard, because unless you know where to look and unless your doctor can give you the information that you need, where do you go? How do you find out about what your options are and what they really mean for your health?
Absolutely. I think getting really grounded in what you value personally, and then how much different factors matter to you, can be really clarifying. There's a shared decision tool that was created at a children's hospital, actually, but I think it can be used in many different situations, especially if you're making a decision with a spouse or a partner, because, decisions that impact fertility impact everyone, right? It impacts the whole family.
Yeah.
And that's exactly what it does. You list out your options, and then you list the advantages and disadvantages as you personally perceive them, and then you weight those. And it just opens up a place for conversation that can be really clarifying. And another thing I like about this one is that it asks great questions to help you identify any gaps in information you may have.
Yeah.
Like, well, I'll feel much more confident in this path if I knew this and this and this. And then where can I go to get that information? Where can I find out?
Yeah.
So, yeah. I'd be happy to share. It's a free template online. I'd be happy to share that for the show notes.
Yeah, we can put
I
that
think it's really helpful. And it can be so overwhelming and head spinning. And so to have a linear cognitive process that helps you get out of your emotions and into your values can be really grounding.
Oh, yeah, because that decision-making process, that was something that really Professor Emily Oster opened my eyes to in the work that she does. She has the book Expecting Better, and then I think Crib Notes or Crib Sheet is another one of her books. And she's a health economist. I've talked about her before on the podcast at Brown University. And that's kind of her whole thing is, I'm not going to tell you what to do. I'm not a doctor, and I don't share your values necessarily. But here's how you can make decisions based on your knowledge, based on your needs, based on your values. And I think, it's so helpful, because you can feel like your head is just spinning, and maybe you've been in pain so long and you just need relief, for somebody to kind of walk you through, okay, like you said, get out of your emotions, and really kind of think through stepwise all of the ramifications of these different decisions. And especially if you're not at the point where you're on literally on death's door, and sometimes we just have to cede control at that point and just trust that our loved ones around us know our values well enough, and that our healthcare professionals are going to take care of us and save our lives. Unless we're talking about that kind of situation, it really does behoove us to take that time and to think through these decisions in this stepwise, very thoughtful manner, taking into account all the things that we've been talking about.
That's right. Free, prior, and informed consent.
Yep.
My sister read a book about labor and delivery, and one of the recommendations was, if an intervention was proposed that maybe you weren't sure about, to say, can I have one more hour? Even just to ask for that time.
Yeah.
And again, just allowing time to reveal what your body is doing can be really clarifying.
Yeah.
So
And
even
that's also,
outside of birth, right, to
yeah.
give yourself permission to take that time and not make a decision out of that like urgency we feel when we are in extreme pain. and, but to like really think long term, big picture. Absolutely.
And it's a good litmus test for whether or not you're with the right healthcare professional, right? Because if
Yes.
you ask that reasonable question, and again, you aren't on death's door, if you make that reasonable request for time to make a decision, and if you're not met with respect and understanding, and you're instead met with pressure, fear, I mean, recognize that that's manipulation, right?
Right. Yeah, you're not being offered a free choice, then we're still not meeting the FPIC criterion, right?
Yeah.
Absolutely. And I think we will all face those hard choices. Every woman will, in different ways, at different times, in ways that are entirely unique to her and her journey. But again, if she has that foundational understanding of how her body works in a state of health, then when she finds herself in that moment, she's so much more equipped to face it, no matter what the outcome is. And she's so much less likely to feel coerced or to feel like there was a bait and switch that happened for her at a vulnerable moment.
Yeah.
So it doesn't save women from suffering, but it changes how we enter into suffering, especially having to do with our reproductive health.
Yeah. Which can prevent trauma, right?
Absolutely.
And regret later on down the line, because, you know, you can have, I forget, I think I was reading on Substack the other day, people talking about different, Serena Sigilito. She's the editor of Fairer Disputations. She also has a Substack, and she had a really great article the other day about what the ideal birth looks like.
Yes.
And she talked about the different births that she's had. And actually, I think hope I'm not mischaracterizing what she said, but I do believe it was one of the births that could have been more traumatic. She has a really severe bleeding disorder, has hemorrhaged very severely after each of her 3 births. And one of them, she actually didn't think of as traumatic. She doesn't associate feelings of trauma with it, despite that sounding really scary and like it would absolutely lead to trauma. But it was because she understood the risks. She understood what was going to happen. She was in a place where she felt the healthcare professionals around her were supporting her and were caring for her, and that they were involving her in the decision making.
Yes.
And so what could have been a very traumatic, very scary situation, she actually on the other end of it didn't even really realize how bad it was, because of how well cared for she felt and how involved in her care and in the decision making that went into her care. What was involved there. So I think it really speaks to the fact that, you know, we do know, and Dr. Naomi Whitaker has done a good job of kind of revealing a lot of this on her Instagram, that a lot of women do come to fertility awareness and come to restorative reproductive medicine, you know, that holistic approach to treating infertility, already from places of trauma, because they made decisions that weren't really fully informed decisions, and it did all sorts of things to their body that they're just now realizing. And so, yeah, they're feeling that there was a bait and switch. They're feeling all of those very valid feelings that come with not having body literacy, and then as an extension of that, not having informed consent around the decisions that you've made with your body.
Absolutely. I think what can help women really heal from that is, again, having that power differential shared with them, like that they are able to receive what they need to exercise their agency in healthcare going forward. As you're telling Serena's story, that's what really struck me, is that even in this hard situation, her agency was engaged. Yes. She wasn't the victim of the circumstances. She knew what was happening, and her choice was honored, and she was cared for. Right? Yeah. So even in her vulnerability, she wasn't just a passive agent in the situation. And I think having experiences like that after experiences of trauma can be so restorative for women's confidence.
Yep. Yeah, that's such a great point. I love that. So this weekend, are all the girls going to come away with this? I hope. I know they will if you've had a hand in crafting all of the training as I know that you have. So
that's my hope. Again, I try to be really clear about what's my lane and what's not. But at least to be planting seeds in this direction, they will definitely come away with an understanding of their bodies that most women in our culture do not have. Mm-hmm. And if we can just accomplish that, I think it's a big win. And we'll have like ripple effects in all their relationships.
Yeah. That's the goal, right? Is because we recognize, like in training really intensively, a small group of women, as many women as we're able, as funding allows, we'll train as many as we can if the funding's there. But when we start with the resources that we have and train the women that we can train and train them well, that really is our ultimate goal, is that we do have these ripple effects, like you said, out into every single relationship that they have with all of the women around them. And we do see that because women who, like you, like myself, like everybody who works at Natural Womanhood, when we learn these truths, we really do. I've not met a woman yet who's had her eyes open to these truths, who isn't on fire for it and doesn't want to share it with every woman in her life, her friends, her mom, her sisters, her aunts. I've shared so much with so many different women just because I know that I'm in this position of knowledge that I can share. And we've seen that with the other young women over the last few years who've led our cycle mindfulness clubs. I love the stories of the young women now who went from leading clubs in college to now they're like in nurse practitioner school or in medical school, and they're actually doing presentations about the female body and fertility and the menstrual cycle for their classmates and what is happening when they do that. Like, that has been such an exciting thing to see, and it just really shows that it's like the story of the man throwing the starfish. The starfish is back into the sea, walking along the beach, and somebody says, "There's so many, you can't. What are you even doing? It's not making a difference." And he throws one in and says, "Well, it made a difference to that one."
That's right. That's right.
I like to think that's what we're doing.
Seeing each woman as an individual, right, and just doing what we can with what we have. Mm-hmm. And trusting that the fruit will be greater than our small efforts, right?
Yep, exactly. Well, Katie, thank you so much for being on the podcast with me today to talk about all of this. I'm so excited to hear about what happens this weekend with our Cycle Mindfulness girls and, young women. I shouldn't call them girls, they're young women. But so excited to see the fruit of that and to see what you are doing in growing all of our different programming at Natural Womanhood. And I'm sure I know we're going to be posting about it on our social media. We're going to be writing about it on the website. And so just everybody listening, keep on the lookout for those things on our Instagram, our Facebook, and at naturalwomanhood.org to see what we're doing and the impact that it's making. So thanks again, Katie, for being here with us today.
Thank you so much for having me.
Thanks again for listening to this episode of the Natural Womanhood Podcast. If you enjoyed it, please drop us a review so other women and couples interested in authentic women's health can more easily find us. Also, please be sure to check us out at naturalwomanhood.org and on our Facebook, Instagram, and X accounts. And if you never want to miss an episode of the Natural Womanhood Podcast or a new Natural Womanhood article, media appearance, or our latest educational content and programming, please be sure to sign up for our newsletter, which can again be found at our website, naturalwomanhood.org. Thanks for sharing a part of your day with us, and we'll see you next time.